There's often a misconception of what facelift surgery really is, and logically the face involves the entire face, and so patients will think a lift involves the entire face. The reality is the face can be broken up into thirds. There's the upper third, which is the forehead, there's the middle third, which is the mid-face, and there's the lower third, which is the jawline and the neck. And so when patients come and they seek a facelift, what they're trying to do is restore the jawline and the neck of a more youthful face. Now, facelift surgery always begins first in the neck. And what we do to address the neck is we make a 1.5 centimeter incision. So it's about this long, and it provides a window for us to access the neck. What we do is we elevate the skin, and often as time goes, we'll accumulate a little bit of fat here. And some people, you'll start seeing these two bands, and that's the front edge of a muscle called the platysma muscle. And what happens over time is that platysma muscle will sag. And it's a muscle that runs from here down to the collarbone. And it's actually a whole sheet of muscle that inserts here and in the collarbone. And the back edge, you can draw a line from the corner of the eye to the angle of the jaw and down into the neck. So as we address the front edge, we'll actually sew the front edge of the muscle together. Now the second part of facelift surgery involves the face. Now I'm going to turn Cindy to the side here. And I like to use a hair-sparing incision. It's a hair-sparing post-tracheal incision, which is an incision that will hug the sideburn and go right into the ear and hug the edge of the structure called the tragus. It'll wrap around and then go behind the ear and back into the hair. And what this allows us to do is to access the area that's sagged. And so when we access this and tighten it, we'll actually tighten the back edge of that muscle. And what that does is it restores the youthful jawline and the neckline. Patients will often come in worried about the facelift look. We often think of the facelift look as a widened mouth and lines of tension. Well, that's a skin-only facelift. So if you just lift the skin and remove the excess skin and just tighten it, it does lift the face, but that's what results in the facelift look. The state-of-the-art way to approach facelift surgery is to tighten the muscle and remove only the skin that's excess. And once that's done, what happens is the jawline is restored, the neck is restored, but you don't pull the skin tight, and so patients will look more natural after surgery. So there is no facelift look other than a more youthful jawline and a more youthful neckline. And that's really what most patients are looking for after facelift surgery, and what I think is an ideal result.